Now, down on the Siemens Health and Ear stand, there are a lot of exciting products being launched. I'm here with Jesus to tell us all about the Somimum Excite. So what is it that you are showcasing here, and why is it such an incredible CT scanner?
Well, actually, we are launching a new computer tomography machine, Somimum Excite, like you said. But we are bringing not only this machine, but a new philosophy in operating the machine, because we notice more and more it's about standardization, it's about helping the user to get the most out of the technology. So not only the machine is the great case, it's also the new philosophy to operate this machine, what we are launching this year.
Tell me a little bit about the innovation and the technology that you use for the Excite.
Basically, we compare it with a smart navigation system. So you can drive, everybody can drive, but you don't know what is the best way, you don't know the way with less traffic, with less cut roads, and we are doing exactly the same with the machine. So we help the user to always find the most optimized way to get to every specific patient. So if the patient is a kid, to reduce the dose as much as possible. If the patient is an elderly person, to make the scan as fast as possible. So to always make the scan as personalized as every individual is. And that is what we are bringing now with Somimum Excite.
So in a way, it's fully sort of customizable, I suppose.
It's personalization. It's something that we also link to precision medicine. Medicine is getting more precise, more accurate, and the diagnostic test before is key to optimize and to make more precise the medicine that the patient will receive afterwards. So if there is any treatment, any test that the patient will get, it will be key on the diagnostic part.
How have you integrated virtual reality into showcasing what you've got on offer?
Siemens has always been known for diagnostic imaging, so for radiology, CT, MR, but we are going more and more in the direction of digitalization, so we have more and more data, and radiologists are using this data to diagnose patients. And now with VR, you can provide a better understanding of the patient anatomy. Sometimes when the radiologist is showing the images to a clinician, which might not be so used to radiology imaging, this virtual reality gives a much better impression of the anatomy. So the physician, or for example the patient, can understand much better the pathology or the anatomy if the radiologist is showing this with virtual reality.
And obviously here at Arab Health, we have got connectivity, and within patient care and patient experience is a really important theme. How is Siemens kind of keeping up with that, I suppose?
Connectivity is again back to the digitalization. So we have more and more data. Sometimes you have hospitals with different centers, also not located in the same city, but in different, so spread around a region. And now what we are doing with this connectivity is being able to support different hospitals from a central location, from a central hub. So you can control, for example, a CT machine from a completely different city, and that makes a lot of sense, for example, if you don't have the expert on site. So you can have an expert in a central hub and just control the machine remotely, and that brings a lot of flexibility to the staff of the institution, basically.